Okay everyone, so now that we went through the course outline, let's continue with the first lecture, which is infection control. The World Health Organization, which was established in 1948 by the United Nations, was established to connect nations, partners, and communities and promote health and serve the vulnerable. The WHO came up with the IPC protocol, which is basically a scientific approach to prevent infection and harm to healthcare workers and their patients. Infection control is basically the reduction and elimination of infection among patients in healthcare settings. And these are implemented by using policies, guidelines, and procedures in order to systematically dismantle basically the chain of infection, or if infection occurred, they can actually promote and implement protocols that will slow down these infections. For example, like we had during the pandemic, things come up, all the nations come together, they all try to find information and put them together in order to help the entire world, in essence, to combat these issues. To implement infection control, we need the proper methods. So, these are infection control methods that we may implement in order to slow down or stop infections. In order to stop infections, we need to survey the our surroundings, so that's surveillance. Isolation, to isolate the pathogens or infections in a localized manner. We have outbreak management. In essence, that's managing the disease. Environmental hygiene, employee education, and infection prevention policies and management. So let's go through these one by one. So surveillance. Surveillance is basically the systematic collection of data, but not just the collection, but it's also the analysis, interpretation, and the dissemination or spreading of that data in order to be able to use it in case of an event in public health. Isolation is intended to minimize the spread of infection associated with healthcare and to avoid direct contact with patient's blood, bodily fluids, etc., paying attention to the universal precautions and bloodborne pathogen standards. The outbreak management is the proper steps and techniques in order that we can investigate a suspected outbreak, and this actually has to do with surveillance a little bit. And using these techniques, you're able to collect the data systematically. Environmental hygiene is basically the cleanliness of the surfaces. You have to effectively clean the surfaces in order to decontaminate them. And these surfaces are used in patient care procedures. And if we want to properly clean them, we have to make sure that the appropriate protocols and handling of everything is done properly. Employee education is basically educating the employees and all who work within an environment like a clinic or a dental laboratory, anything that has to do with healthcare settings. And the training should be very specific to the different steps that we need to take care of the infection control procedures. Infection prevention policies and management this is the implementation of the IPC protocols, and these are done by the different departments of the companies, and they implement these policies and make sure everybody follows all of these regulations that are put in place in order that the employees and the employers are safe. It's all of our responsibility, basically, dental technicians, healthcare workers, and anybody who's in the laboratory, in order that these protocols are followed so that everyone in the environment can be safe. Now, the dental facility, whatever it may be, a laboratory or clinical place, like a dental office, have the responsibility to provide personal protective equipment, and that includes eye protection, outer coverings, masks and gloves. You know, the eye protection could be your safety glasses, and these glasses should be in line with the regulations as far as protecting your eyes from the sides, from the front. The glasses should be hard enough to prevent any impact to go through the glasses. The scrubs and lab coats should be worn so that you do not take home infection and you don't infect your clothes. Now it would be great if the laboratory, have their own laundry service so that you do not have to take your laboratory coats home in order to wash them. This way it will prevent any kind of infection from being carried from the laboratory to your home. Masks should be replaced all the time, so it can get expensive for a person to keep buying masks. So the laboratory or clinic is responsible to provide these for you, and that includes the gloves also. Universal precautions. Basically, these were introduced by the CDC, the Centers for Disease Control. So this is a standard set of guidelines to prevent the transmission of bloodborne pathogens. And the main characteristic of this universal precautions is that we must treat everything in the laboratory and clinic as if it was known to be infectious. These infections will be microorganisms that can contaminate your clothing, or it can enter in one of the ways into your body, such as cuts or breathing it in, or through your eyes, and equipment if not treated properly. Just as an example, oral bacteria can remain viable in gypsum for up to 7 days. So how do we prevent this from happening, for example, would be to make sure that all impressions are properly disinfected, in order that when we pour the impressions, these microorganisms will not be incorporated into the stone. There's always a potential that microbes are going to be transferred into the dental laboratory. Exposure to potentially infectious materials can be from impressions, can be from the blood and the saliva on those impressions. It can be from rubber gloves, can be from packages, could be from burrs in the dental office. And this is called cross-contamination. Cross-contamination is the transfer of microorganisms from one to another. And these can be from different things. This can be from patient to patient, patient to dentist, dentist to technician, from people to people, it could be just from touching a doorknob that has been touched with a dirty glove. You can cross-contaminate from there. It can be from airborne droplets also. As the doctor is preparing the teeth, they can actually aerosolize, the microbes from the teeth structures themselves. So as they're grinding on the preparation, the fast spinning burr will actually throw the microorganisms into the air, because not 100% of the microorganisms get washed away by the water that cools the preparation as they are drilling on it. Diseases that we can get as dental technicians are Hep B, 3 times more infectious, gets transmitted through body fluids and affects the liver. There are vaccines that are available, and there is no cure for this disease. Hep C gets only transmitted from blood to blood. It also affects the liver and is more likely to become chronic. That means they are more, it's kind of like a lifelong disease that comes and goes. And for Hep C, there is no vaccine. We have HIV, human immunodeficiency virus. And this virus affects the immune system, only gets transferred from blood to blood, and it has no cure. However, they have medications that suppress this virus, and it allows the immune system to take it over to levels that are undetectable. However, there is no cure. TB or tuberculosis gets transferred through the air. It affects the lungs. You have a very bad cough, sneeze, expectoration, which is spitting, and there is no cure for that. There is a vaccine, however. Herpes, there's a primary and secondary infection. Over 80% of the population have herpes, and the primary is a stronger infection than the secondary. Chain of infection. Okay, so the chain of infection is basically the way of microorganisms to get into the body. So this is the chain of infection. Okay, mode of transmission, portal of entry, susceptible host, infectious agent reservoir, and portal of exit. The important thing is that if we just prevent one of these, we can stop the chain. Okay, so if we can affect the mode of transmission in some way, or the portal of entry, or have a control of the susceptible host, infectious agent, if we can actually kill the microorganism, clean the reservoir so that there's no place for the microorganism to manifest, or the portal of exit where it can't get out. So let's go through these one by one. So let's go from the mode of transmission. It's how a pathogen moves from the reservoir. And this is usually direct transmission by airborne droplet. Contact, e.g. through the skin, a bite, needles, or other sharp injuries. Indirect transmission would be fomites. contaminated equipment or medication, multi-dose vials, single-dose vials, things like that. Vectors such as food and water. And that's a mode of transmission. Portal of entry is an opening where the pathogen may enter. So a portal of entry would be body openings such as mouth, eyes, urinary tract, respiratory tract, incisions, wounds, things like that. The susceptible host is basically the person at risk or you. That is the actual person. And factors that affect susceptibility are basically age, health, comorbidities, immune system, nutrition, the amount of infection, and also medications, maybe counteracting medications or things like that. The infectious agent would be the actual disease-causing microorganisms like the viruses or bacteria and such. Then we have the reservoir. The reservoir is basically our environment where everything takes place. It's the habitat of the bacteria. Environmental surfaces like equipment that houses the body fluids. Maybe we grabbed something and there's some blood on it. It could be urine, fecal matter, food, water, soil, skin. The respiratory tract may house these microorganisms, and this could be the reservoir. And then we have the portal of exit. It's how the pathogen exits or leaves the reservoir. All right. So the portal of exit is like skin-to-skin contact. We have the contact of a cut with the blood or mucous membranes of the oral cavity. There could be a cut on that, a cut on your skin. Some things may enter if they're small enough through the skin surface without even have to be a cut. So that's our portal of exit. Here's a short video on the chain of infection.
Morning, Barbara. Are you okay? To change that dressing of yours that you've had on for about 2 or 3 days. Yeah, is that okay with you? Yeah. Did you sleep well? What are you reading today? Oh, so you like cooking, yeah?
as we can see, how easy it is to cross-contaminate the entire environment. So please be cognizant of these facts. So let's go through a couple of things here. The infection control terminology. So antiseptic. What is an antiseptic? Is basically something that prevents infection, like a chemical applied to a tissue to inhibit the growth of microorganisms. For instance, when you get a cut on your finger, you apply an antiseptic to it. This way you prevent additional microorganisms to enter and also kill the microorganisms that are already on the cut. Asepsis. Asepsis is a condition. It's a condition of not having any infectious material on that particular surface. So as we read here, it's a pathogen-free condition. That is the process of preventing the access of microorganisms. So once you use the antiseptic, you create a condition of asepsis, which means there's no more organisms entering that area. Disinfection. Disinfection is the destruction of most bacteria, and why we say most is because we exclude viruses. Viruses are much more difficult to clean, so viruses are cleaned by sterilization, which we will go through next. So disinfection is the destruction of most microorganisms or most bacteria. It usually refers to bacterial infections. Sterilization, on the other hand, is a process of destroying all of the microorganisms, including viruses and spores. Spores are even more difficult to destroy than viruses because they are encased in a material that is more difficult to penetrate by these agents. An aseptic technique is the proper use of instruments to ensure sterilization procedure. So an aseptic technique is a way to ensure that the items are sterilized and disinfected. So by using the proper materials, like for instance, if we want to sterilize something, we're going to use a sterilizing instrument or a sterilizing machine in order to sterilize specific materials or instruments or surfaces. So that's an aseptic technique. It's the proper way of doing the sterilization. So bioburden is basically the material, a large amount of material that is accumulated on an instrument that is visible. Okay, so in order to remove bioburden, we must mechanically remove it by using brushes and things like that. Something that we can use to scrub those instruments and remove the visible biomaterial that is left on it. Okay, so let's go over the types of items that we have in dentistry, in clinical and lab settings. So we have the critical items. These are objects that enter the skin, mucosa, or vascular system. So these things must be sterilized, okay, because these actually enter the skin. So if it goes through the skin into your system or the mucosa and it gets in contact with your vascular system or your blood vessels and arteries and your circulatory system, these things must be sterilized because we cannot have any of these biomaterials enter the bloodstream, because they can systemically affect your body, and it can get you infected way faster, since your bloodstream will very quickly disseminate it throughout your body. These are the greatest risk items, so that's why it's called critical items. These are the greatest risk. They must be sterilized, and some of the examples are scalpel blades, hypodermic needles, surgical instruments, and obviously if you look at these instruments, they all penetrate the skin. The second type of items are the semi-critical items. These are items that frequently contact the mucosa but do not enter the tissues. Okay, so these are the frequently contaminated by secretions. For this we need mid-level disinfection. So mid-level disinfection is basically less stringent than sterilizing the instruments, because they do not enter the circulatory system. Your immune system will usually take care of them, but they still do need to be disinfected, because we need to remove most of the material. Some of these infections become infectious because of the amount of bacteria that is left on the instruments. So most of the bacteria should be removed, and a couple of them, if they're left on the instruments, it will not hurt you, because the immune system will generally be able to take care of it. Obviously, some of the examples of these are shade guides, face bows, jaw relationship records, impressions, and prosthetic devices. If you look at these things, none of them poke through your skin or enter the skin, so they can generally be just disinfected and just reused on a different patient and things like that. So these types of things are usually they're either discardable, or we can just disinfect them and reuse them on other patients. So we have the non-critical items next. The non-critical items, they are non-critical, but they don't mean that they're not important. Okay? Just because it says non-critical doesn't mean that we should just ignore them and leave them dirt. These do not contact the mucosa or skin. They require an intermediate level of disinfection. The examples of these are basically receiving areas, case pans, and articulators. Receiving areas are areas where we receive the packages with the cases. So we can just basically clean off the surfaces with a disinfectant. Obviously, properly use the disinfectant. They do have instruction manuals with them, so that we can use them as the way they were intended to be used. The case pans obviously get in contact with the impressions and models, and everybody touches them and things like that. So they should be disinfected after the case is finished, and then we're going to put them in an area where it is clean. And then we have the articulators, which should also be disinfected, because obviously we attach models to them, so the models could be infected in some way, and this way we can always have a clean articulator when we move on to the next case. A unit dose. A unit dose is basically a material that is measured out, and it supplies one single patient. Okay, so it's sort of like a pill. Like take 2 pills a day for this person, and for X amount of months. A unit dose is basically the amount of something that is measured out for a patient. For instance, if you have a unit dose of medicine, or a unit dose of like a disinfectant, or maybe filling material in a dental office, things like that. And it's just a pre-measured amount of some material that is used on one patient. Universal precautions. We mentioned universal precautions. Universal precautions are to treat all body fluids as if they were infected, and the instruments are assumed infectious. Cross-contamination, we went over before, is the transmission of microorganisms from one source to another. So direct contact, or droplet transmission, meaning you get sprinkled by some saliva or something like that in your face, and it's transmitted that way, or you actually inhale a microbe by it being airborne just from grinding of a high-speed handpiece, or as the doctor prepares a tooth. These microorganisms can become airborne from just the sheer speed of that drill bit drilling on the tooth. Here's a little video on effective cross-infection control, which is basically effective cross-contamination.
Hi there, I'm Claire White, your infection prevention expert. Every element in the practice represents a ring of the so-called chain of infection. If one is infected, it can contaminate all the others. But Cavo and Care can help you break this chain with effective solutions. Hand hygiene and personal protective barriers are the basis known to all. So let's start with non-critical medical device surfaces. To have an effective disinfection, always make sure you clean first. Cavi Wipes is a low-alcohol, pre-saturated disposable wipe to be used in a 2-steps process. A first wipe cleans bioburden, while a second one effectively disinfects the area. After disinfecting, you may choose to use protective barriers. Care Pinnacle barriers have passed blood and viral penetration tests. Your treatment unit may also harbour bacteria. Cavo Estetica E70 E80 Vision has a smooth surface with minimal gaps and removal parts, which make cleaning quick and easy. The fully integrated hygiene function includes automatic cleaning of the suction and drainage system, additional high-intensity germ reduction even during extended downtimes, and a contact-free operation via a foot control. Cross-contamination can occur where you least expect it, so disposable items are a great solution. Consider single-use examination kits to reduce risks. Disposable air-water syringe tips are also recommended. Seal Tight eliminates wear and tear, providing a fresh seal with every new tip. During prophylaxis treatments, paste splatter, blood and saliva can cause wear and create a cross-contamination hazard. A special seal in the Cavo Smartmatic heads prevents these intrusions. Moreover, the Smartmatic series is designed for automatic reprocessing, and its smooth design and rust-free stainless steel surfaces makes it considerably easy to clean. To further limit risks, use ProCup, disposable Profi cups designed to minimize splatter. The Cavo Quattro Care Plus handpiece maintenance system is easy to handle and can maintain 4 instruments within just 1 minute. While cleaning, use a cassette like Stericage to minimize contact with contaminated instruments, and use an enzymatic solution to moisten debris on your instruments, such as Empower Fragrance Free. Before sterilization, place your instruments inside a sterilization pouch. With PeelView Plus, it's easy to get a safe seal every time and to check if the components have been processed. Did you see how Cavo and Care work best together to make your dental practice safer? Discover more on caredental.com and cavo.com.
Infectious. We must always keep in mind that in a dental laboratory you always have the potential to become contaminated. So, at the risk of repeating myself, we must always keep universal precautions in mind because it forms the foundation for the prevention of infection. So what do we know about the universal precautions? Is that we must treat everything that comes into the laboratory as if it was infected. Routine infection control procedures must always be observed in the laboratory. Every laboratory have their own infection control procedures which kind of align with the IPC of the World Health Organization. For example, the engineering principles, personal protective equipment, chemical disinfection, sterilization, vaccination, they all play a role in minimizing the exposure to pathogenic microorganisms, which basically infectious microorganisms. So there are specific principles that we must adhere to while building the laboratory, while we are arranging the equipment in the laboratory, in order that we do not contaminate the entire environment of the laboratory. So let's go through chemical sterilization and disinfection. Okay, so certain instruments in the laboratory, or to that fact, especially in the clinical environment, cannot be sterilized by heat. Heat sterilization is usually 212 degrees at least, and it is heated up in a closed system using steam, and it kills all of the microorganisms, including spores and viruses. But in certain instruments, like they are made out of plastic or they are heat sensitive instruments, and these types of instruments, they cannot be heat sterilized, so we use chemical sterilization techniques. Chemical disinfectants are available with varying degrees of effectiveness. Now, some of them can sterilize, some of them can only disinfect, and some of them are strong enough to sterilize if they're left exposed to those particular surfaces. If they are not left for a specific amount of time, they can only be considered disinfectants. Disinfectants can be ineffective on heavily soiled materials. For instance, when we have a dental prosthesis that has a lot of calculus on it, some caked on materials, these materials can seal the contact point between this material and the instrument, or this material and the prosthesis. So even if you put it into a chemical sterilizer, it may not reach that deep into that soiled material. So what happens? The surface will be sterilized, and once that material becomes dislodged, the infection will still be there underneath that material that soils that instrument. So in those times, these are called the bioburden that we talked about earlier, that heavy caked on material like the calculus on a partial denture, for instance. So debridement is necessary, and debridement is the removal of this heavy bioburden from that particular prosthesis or instrument. And that is a necessary protocol to that type of disinfection. There are 3 levels of sterilization and disinfection. One is high level, mid level, and low level disinfections. Here's a short video on disinfection and sterilization in a dental office.
We just wanted to talk to you a little bit about our sterilisation system and centre. I'm just giving you a little look around at all the various things here. We've got our autoclaves there, and we've got this colour-coded system here. So this particular area is our area where we do our instrument processing. But I'm going to hand over to somebody who knows more about it than me, and that's one of my valuable assistants, Lauren.
Hello. So at the moment I'm holding a used cassette. So this is for a restoration. So the dentist in the surgery has placed all the instruments and locked into the cassette, just like so. So they're placed in like this to get a thorough cleaning, to make sure all the areas of the instruments, all the debris and everything has been removed. So we have an ultrasonic cleaner here. This cleans our smaller instruments, burrs and such, whereas this cassette will go into our thermal disinfectant washer. So the washer here makes sure that all the debris is removed from the instruments. The washer can fit quite a lot of instruments in here, and the load can go for about 2 hours. So this makes sure that the instruments are really cleaned. And we'll get back to that one.
That's okay.
Yeah.
So to get rid of biofilm.
To get rid of the biofilm.
Yeah.
And then they are thoroughly washed and then dried as well. So they're ready for packaging, the next step of the sterilisation process. The hand pieces, this is our
Automatic oiler.
And the hand
And cleaner.
lubricator. Each handpiece is placed into the lubricator and has a cycle which cleans them and checks their air pressure as well. Once these are completed, we can go into the bagging area. So we can pop these in a bag, which will then go through the autoclave.
Okay. So how would we know that they've gone through the autoclave? What's the test?
So there are indicators on each of the bags that show us that the autoclave has reached its parameters of 134 degrees for 3 minutes.
Oh, goodness me.
So they're placed into the bag and we pop them on trays. Once we have some trays ready to go, we can pop them in the autoclave. We actually have a finished load at the moment, so I'll remove my gloves. That's what I need to get for next time. And I'll unlock the load so that we know exactly who completed the load and that the instruments are successfully cleaned. They are quite warm when we get them out, so we are careful. So we have some instruments in bags and some in a sterile wrap. So I print out barcodes for all the critical items. And now I'll just enter these into the computer so that we can find out exactly what instrument went through on what machine.
So when that instrument package is to be used for a specific patient, what happens then?
So for each instrument that's used for a patient, their barcode is scanned into the patient file. So we have a thorough record of everything that was used for the patient, what autoclave they came from, and what cycle they came from.
Well, thank you very much. I think that was excellent. I've actually learned a little bit myself, and I knew you girls were good, but now I'm very impressed. Thanks very much.
Thank you.
Okay, so this is where we start describing some of these sterilizers, which we'll just be able to just go through it real quick. We don't really need to memorize them or anything, just so we know that they're there and what kind of materials they really are. So the ADA, the American Dental Association, has a recommendation of these particular 5 disinfectants / sterilization chemicals. So we have the phenolic disinfectants, the bactericides. So this material actually kills the bacteria. These are not FDA cleared as high level disinfectants. In high concentrations, phenol carbolic acid is a protoplasmic poison. So protoplasmic poison basically kills or inactivates the insides of a bacteria or the cell. Synthetic phenolics have been accepted as disinfectants, and combined with a detergent, they can usually be used very well as disinfectants. The next one is chlorine or sodium hypochlorite. This is your basic household bleach. It usually comes in 10% solution. It's an intermediate disinfection. In 30 minutes it will disinfect your instruments. However, it has a very strong odor, so laboratories and clinics have been staying away from this for quite a while because of that odor, and it does affect the eyes, skin. It discolors clothing. You know what happens when you spill Clorox on your clothes. It kind of bleaches out the color, so you basically ruin your clothes. It has a dangerous reaction with ammonia, so obviously people don't really go with that. In fact, you have to be careful even when you buy it, so that when you buy chlorine or Clorox, you don't want to put it together in the same bag with ammonia, just in case they spill. You don't want to create the gas, ammonia gas that it produces. Chlorine dioxide is the next one. This is pretty new, and it's been approved by the EPA. It's non-toxic, non-sensitizing, and it's safe on most items. 6 hours immersion will create a sterilizing effect. It does have only a 14-day shelf life, so it's pretty short. It does not have to be wiped off of surfaces because it's not dangerous, it's non-toxic. If you use it within 24 hours, within 1 minute it will create an intermediate level of disinfection. If you use it after 24 hours, it will require 3 minutes of immersion before disinfection is considered to be effective. And then we have the iodophores. These are intermediate level chemical disinfectants. They carry and release free iodine. Iodophores are between 0.5 and 1.6 iodine, and usually and detergents. Okay, so these are some examples of the companies that make them. The vapor pressure is low, so it does have a very low iodine odor. So it is required that it stays on the surface for 20 to 30 minutes. Antiseptic iodine is not really recommended for surface disinfection. Why? Because antiseptic iodine will discolor anything it touches. It will create like a brownish kind of color on the surface, and for most surfaces you'll never be able to remove it. This is mainly for using it on wounds and disinfecting just open wounds or abrasions and things like that. As you notice, sometimes they use this antiseptic iodine just before surgery. They'll wipe down the patient because it does do a very good job in killing the microbes. The next one is glutaraldehyde. It is a high-level disinfectant. It's very strong. These are the companies that manufacture it. Chemical sterilization is possible with this. These are alkaline, neutral, acidic, so they make different types of them. The types of glutaraldehydes used for disinfection are the same as for sterilization, but their usage differs. So the ones that you use for sterilization, obviously they are much stronger than the ones you use for disinfection. So the way you use them is different. Glutaraldehydes usually come in two parts, a base and an accelerator, sort of like our impression materials kind of, but not really. So you mix the two parts together, and then you start the countdown toward to the lifespan of the material. A 10-minute immersion in this will create an intermediate level of disinfection. If you immerse your instruments overnight, 6 3/4 to 10 hours, it will sterilize the instruments. So, generally people use the steam sterilizer unless you have those sensitive instruments I talked to you about, like the plastic instruments that are affected by heat. So these are best used as immersion disinfectants. So you don't want to spray these on. You want to put them in a container, and you want to immerse your instruments into them. So the next one is the formaldehyde compounds. Now these are really strong, and they are used as liquids. You submerge your instruments into it. And these have very specific ways of utilization, so you have to be very careful on how you use them. The FDA has specific requirements on their usage. OSHA indicated that the formaldehyde should be handled in the workplace very carefully as a potential carcinogen. And there's only a very limited amount of exposure time. So if you look at it here, you have an 8-hour concentration of 0.75 parts per million. ppm stands for parts per million. So if you have this concentration, you have a maximum exposure time of 8 hours. If you have a 2 parts per million, then your exposure time is only 15 minutes per day. So Title 29 of the federal regulations actually is written in to this, the Code of Federal Regulations, in order to protect the employees and anyone who is exposed to this material. Okay, so we have 8-hour concentration at 0.75, and we have 15-minute exposure time at 2 parts per million. And then we have ethylene oxide. This is a gas sterilization, which you require to have specified equipment, as we see here. And this is mostly used on like gowns and uniforms that need to be sterilized in like surgeries and things like that, that you cannot sterilize otherwise. You can't just wash them because that's not sterilization. So this is actually a gas sterilization, and after we sterilize these types of like clothing and things like that, ethylene oxide needs to be vented out of this material, so it must be vented for a minimum of 12 hours before it can be used on a patient. It may be carcinogenic or mutagenic. Carcinogenic, as we know, it means causes cancer, and mutagenic means that it actually causes mutations in the cell structure. So we must pay close attention that we use this according to OSHA standards, because they have done the studies on this. So we must be mindful to follow those regulations. So key concepts in the laboratory infection control procedure. So laboratory must be clean and well organized so that we can prevent infection. So if we are organized and we are following all the protocols for infection control, the contagions should be contained. Each technician must maintain a neat and clean working area after each procedure. Okay, so after each day, we wipe down our area, we disinfect it to be ready for the next day. At the end of the day, also the entire lab must be cleaned. The workbenches, lathes, bench engines, all of these things that we've used on the different cases, we have to clean them. Floors must be swept, mopped, and waxed. Instruments must be cleaned and returned to their original place after they're cleaned. Okay, so what are our infection control procedures? The most important thing is to wash our hands. Second thing is we must wear our personal protective equipment every time that we are doing specific things. When we're grinding, eye protection. When we are handling impressions, we have to wear our gloves, our mask. When we are mixing stone, mixing investment, sandblasting, wearing our masks. Lab coats should be put on as soon as we enter the lab, so that we don't dirty our clothes, so that we don't carry germs home. So most preferably the lab coats should be left in the lab, and hopefully the lab has a cleaning service so that we do not have to worry about taking these materials home with us. Clean all counter surfaces and case pans to be used during the disinfecting procedure. Clean all counter surfaces, okay? And case pans used to be used during the disinfecting procedure, okay? So all of these counter surfaces need to be cleaned after we disinfect it. we still need to clean off. Sometimes certain materials we need to wipe off with water after the disinfectant stood there for a little bit for the prescribed amount of time. Spray counters and case pans with the appropriate surface disinfectant. Leave on the surface for the appropriate amount of contact time. Each of these materials, they have a specific amount of time to leave on the surface. So usually about 10 minutes, but you have to check your manufacturer descriptions. And then after you waited the 10 minutes, then you use clean water and a towel to clean that off. Because these materials sometimes can be sensitizing to different people. So we don't want to leave them on the surfaces. In order to do this properly, we must set the timer so that we're sure we're doing the proper procedures. Wipe down the counters after the contact time is completed. That's what we mentioned just before. And then we'll be ready to receive the cases. So here's a little chart about the different types of impression materials and how to treat them and how to disinfect them. So we have alginates, immersion with caution. Okay, so this means that alginates are very sensitive, so you do not want to put them in disinfection too long. Agar can be disinfected only by spraying for 10 minutes due to its hydrophobic properties. So hydrophobic properties means that the water will roll off of it. It's not going to be absorbed by the material. So it is possible to just spray it with some disinfectant, leave it for 10 minutes and then wash it off. Polysulfide silicones, same thing with that. It's very hydrophobic, doesn't absorb anything, so it can be immersed. Polyether, same thing, but immersion with caution, because it can be dissolved by some of the disinfectants. Zinc oxide unguenal spraying can be used for bite registrations. ZOE is most of the time used for impression, just bite registrations because of its rigid properties. Impression compound, same thing. It's very rigid. It does not absorb anything, so it can be just sprayed or immersed in disinfectants. So, wearing PPE is very important. A clean, reusable face protection which can be cleaned between patients if visibly soiled by cleaning and disinfecting. So, most likely you will be wearing PPE that goggles, safety goggles can be cleaned, and those are reusable. You don't want to throw them constantly out because they can get expensive, especially the good ones. So soap and water between patients, or you can disinfect it by some material. You just have to be careful which disinfection you use, because some disinfectants can cause a problem with plastics. So you don't want to clean a lens with something that dissolves plastic because it's going to make it cloudy. Clean off receiving counter, that's obvious. We must clean that off. We usually spray it with some disinfectants. We leave it for the prescribed amount of time and then we wipe. We mentioned this before. We spray it, we leave it for an amount of time, then we wipe it off, and then we're ready for the next item to be relieved. Neutralizers for chemicals, okay? So neutralizers are chemicals that counteract the effects of other chemicals. So to neutralize means to counteract. For instance, of acidic type of materials, when you add neutralizer to it, it will neutralize the acidic effects, so it no longer affects other materials. And we can refer to our safety material data sheets, the MSDS, for specific neutralizers for specific chemicals. And that's the end of this lecture. And if any questions, just please place a question in the Ask the Professor section, or you can email me, or you can text me, and if you really need an urgent answer.